to fast before the procedure, like those going for surgery? The answer is no. Before an HIG procedure, you don't need to fast. So you can take light food and also drink moderate amount of fluid. Okay, you can eat light food and also take moderate amount of fluid like juice and water, juice, and all that. All right. However, do not maintain a very full stomach. All right, because some people, when they are having some discomfort or pain and they have a full stomach, they can easily vomit. So you don't need to fast, but you can take light food, but don't maintain a very full stomach. All right. And another question that some people may ask is, HSG procedure, does it involve making an incision or having a cut in the tummy or any part of or in the private area? The answer is no. An HSG procedure does not give you any incision anywhere. All right? There is no incision. This, what should you take along when you are going for an HSG procedure? What you should take along is pad. Very important. You take pad along. So let's discuss the HSG procedure proper. Okay, what does the HSG procedure really entails? Number one is that a woman will lie on a table, okay, an X-ray table, okay, and then positioned in a particular way such that the private area is cleaned up, and then a sterile instrument called speculum is introduced gently, well lubricated, and introduced gently into the vagina, all right, to open it so that you can see the cervix, all right. So this is an example of speculum, all right. It's usually small and it's introduced gently into the vagina to open so that the cervix can be seen. Then once the cervix is seen, then the doctor will try to negotiate this instrument, the catheter, into the cervix, all right? Okay, so that it will go in through the cervix into the uterus. It's a catheter, all right? There are different forms of catheter that is used during HIG, all right? And this is just one of the examples. It can be something like this. The others that can be something like this as well, all right? They are metallic type and they are plastic type, or those that are made of different form of material, all right? Now, when this catheter is introduced, okay, into the cervix, through the vagina, all right, into the cervix, then the catheter it has a place where you can put small amount of fluid through to cause the balloon in the catheter to inflate, to block this cervix, so that any other fluid that you will put in to the uterus will not leak out from the side. Okay? So once the catheter is placed and secured in position, okay, then the speculum is gently removed. Then what now happens? Then this is a syringe. Please don't pardon my diagram. This is a syringe and it contains a liquid, okay, especially liquid, we call it a contrast, okay. This liquid is pumped into this catheter so that it will pour out inside the uterus like this. All right, so you are pumping this fluid, which is the contrast, into the uterus. Okay, the contrast will fill up the uterus, the inside of the uterus. All right, and then an X-ray is taken. So therefore, the X-ray will show whether this contrast is filling the uterus very well, and to be able to detect if there are areas where there are no filling. If there are areas where there are no filling, it means that area is attached together, or there is a mass in the uterus, body of the uterus, that is protruding inside the cavity. So what you will get will be something like this for the uterus. What it should show. This is what it will be. Just from here to here, like a triangle. Okay? Yeah, it shape may vary a little, but by the time you are seeing something like this, it means that this area, there's something that is there. And in some cases, you may not even be able to appreciate anything at all, or it gets to this point, just like this, it stops. That means likely there's a blockage, or the front and the back part of the uterus are attached together at this level, which from that level up, the contrast cannot get there. All right. So this is the only place that will be displayed on the contrast or on the film after an X-ray. More contrast is pushed in, all right, so that it will keep filling, it will start filling the fallopian tube. So if the fallopian tubes are opened naturally, what will happen is that after filling the inside of the uterus and you put more fluid, the fluid will have no option than to pass through here and pour out here. Okay, it pass through here and pour out inside. So another X-ray is taken, all right, which now is to just demonstrate whether the fallopian tube is filling up, all right. So when the X-ray is taken, because the X-ray will see the contrast where it is, all right. So if the contrast was able to move down here through the fallopian tube, it will be shown on the X-ray, okay, X-ray film. It will be shown on the X-ray film, and then after about 5 to 10 minutes, okay, then they take another X-ray, which is a third X-ray. We call this the delay film, all right? The third X-ray is to know whether there is spillage of the contrast into the pelvis, all right? Whether it's spilled out. So naturally, if you force a fluid through this place, and here is open, and there's an opening here, it will pass through and pour out here, okay? So that last film, which is the delay film, may be taken by 5 to 10 minutes later to demonstrate whether there was contrast spilling out in the pelvis. So it means that from common sense, if there is a contrast, you put in a contrast through here and it comes out, you are seeing it here, outside here. It means that this place is open. Because if this place is not open, there's no way you can make it down this way. All right? That is what the HSG actually entails. And after the procedure is done, the catheter, this balloon is deflated, the catheter is removed, the woman is cleaned up gently, and she given some privacy to go and dress up. Another question is, how long does this procedure actually take? This HSG procedure take about 10 minutes on the average to 15 minutes, 10 to 15 minutes, all right? Yes. That is because from the time this catheter is inserted, it only takes about 10 to 15 minutes because X-ray is taken first when the contrast is introduced. Then, as the contrast continues to be introduced, another X-ray is taken, and they wait for about 5 to 10 minutes. They do another another X-ray, which is delay film. Then the catheter is removed after deflating the balloon. Then the woman is cleaned up. So it takes about 10 to 15 minutes. However, the actual time you spend may vary because sometimes, as some women may have difficulty in trying to introduce this catheter into this cervix. Especially for those that have not given birth before, or they have not had any procedure that involve passing any instrument through the cervix before, their cervix may be very, very tight, all right, very narrow, that trying to introduce this catheter may cause some difficulty, and that can prolong the procedure.